Hi, my name is Ryan Varula. This is my third video presentation on the National Asthma Education and Prevention Program, or the NAEPP, and we'll be talking about more in depth about the management and the therapy use of asthma and how we treat it. So, classifying asthma severity and initiating therapy. So we can break it down this way. We have different components of severity. We have an intermittent, and persistent. So we have something that's gonna happen over a period of time, but then there's the persistence of it. Then we have like three categories under that. We have a mild, moderate, and severe. Of course, mild being the most basic symptoms. You have some bronchospasms, some constriction, and severe being more the life-threatening realities that people face with asthma. So some of the symptoms that we see for ages from 0 all the way up from 12 and over, even to adults, usually they get symptoms of less than 2 days per week. So that could vary from having maybe not a productive cough, but a chronic cough, or some type of like constriction of the bronchioles, or some type of, you would say, uh, spasms as well. So kids under 4 don't experience the nighttime awakenings as much as they do for 5 and over up until adulthood. They usually experience like a nighttime awakening 2 times a month, or even less than that. It's not frequent, but considering their age group, it can be a pretty intense thing. Waking up, not being able to catch your breath, not being able to, get your oxygen in. And then both of them, or not both of them, sorry, most of all the age groups use at least a SABA for symptom control, but not to prevent a EIB, or an exercise-induced bronchospasm, but they do use it less than 2 days per week. So each day they're using it. It doesn't specify how long or how many times they're using their inhaler, their rescue inhaler, but it says that they do. Again, none of them are interference. They don't have any interference with normal activity. Their lung functions, you can't really get a lung function spirometry on kids 4 and under, but kids 5 and over, they seem to do fairly well depending on the patient that you get. But you will see, FEV1s between 80, 70, usually nothing below 80. So then you'll see for the younger group, they have a better management of that. So their FEV1% and their FEV1 over FEVC are either a bit low or on their normal side, but you also have, so if we, go ahead and talk about the different stages, the mild, moderate, severe, it really just depends the patient at the time. Again, you would think, you would often see pretty intense, number for I'm trying to say. So you would kind of see sort of like an intense number of asthma attacks, or some type of symptoms related attacks for asthma in these age groups. Usually they average around 3 or 4 times, whether that's a month or days out of the week, depends for the severity. So if you have a mild, ages 0 to 4, you're going to see at least symptoms occurring 2 times or more than 2 days a week, but not daily. You are going to see for the younger ones 1 or 2 times a month, so that could happen then. Or you'll see ages 5 and over from 3 to 4 times a month, but these are just the mild limitations. There's not much there. They still do have a normal spirometry, but it is on borderline. Sometimes you have to keep that on watch. But if you're moderate, that's the more you start getting into that area where it's like, hey, you need to make sure that you're staying away from your triggers, that you're not purposely, forgetting your asthma inhaler. You always have it with you and stuff like that. They get daily, they daily symptoms, and because of that, they'll have to use their SABAs daily. So for all age groups there that have a moderate persistent asthma. But then again, their spirometries are pretty low, not that low. Again, you can't get the spirometries for ages 4 and under, but as you can see here, between 60 and 80, 75 and 80, 60 and 80, and then a reduced of 5%, they are going to see lower numbers there. Then you have the severe. It takes a big leap forward for all age groups because they'll have symptoms throughout the whole day, which is, depending on the age group, can be very restricting, can be very excruciating for them as well. And then you have at least several times per day they're taking their SABAs, so you have an increased heart rate, their anxiety is going up, they might even get some shakes in because of how the concentration for them might be a little stronger. But you'll start seeing lower diminished spirometry values there. Classifying asthma, you're going to have their severities in initial therapy, the risk. So to kind of dive into there, asthma exacerbations are going to require an oral systemic corticosteroid. That's something that's going to be given. It's going to be a part of their asthma plan throughout their whole life, or as long as they have their asthma. Some are unable to get it reversed, but if you have a more of they'll have to use that at least one time per year. That's kind of the average for all age groups there. But if we're going to talk about different severities, then if they're mild, they'll have an exacerbations maybe less than 2 exacerbations in 6 months, or wheezing less than 4 times per year. That's lasting at least 1 day in risk factors for persistent asthma. So those are going to be from age groups for 4 to 0 or 0 to 4 for they're very mild. But once you start getting past that, now you're going to see exacerbations of at least more than 2 times per year, and that's for all age groups there, except for the 4 to 0. But generally, they're more frequent. Their intense events indicate greater severity, so they're generally more frequent and intense, so they're just greater in severity. And of course, the higher you go in your severity, the more exacerbations you're going to experience, which is not a fun thing for the people that struggle with asthma. So what recommended steps for initiating therapy? So we could go ahead and do a step 1, step 2, and think of it as this. And we'll dive more in that in the next page, but in the next slide. But in 2 to 6 weeks, depending on severity, access level to asthma control achieved, and adjust therapy as needed. So again, you're going back to your PCP, you're letting know what exactly happened, if you've been to the hospital, what did they find, what values did they have to give you for you to pass along, and then try to make it where that doesn't happen again for you as well. For assessing asthma control and adjusting therapy, we have different components of control. So we have a well-controlled, not well-controlled, and a very poorly controlled situation. This is going to be the same age groups as well. We're going to look at their symptoms, especially their impairment of so the symptoms, nighttime awakenings, interference with normal activities, the SABA uses, lung function spirometries, and then validated questionnaires. So these are going to be surveys that they take. But also we'll be looking to the risk and where that can take us from there. Asthma exacerbations requiring oral systemic corticosteroids, a reduction in lung growth / progressive loss of lung function, and then treatment-related adverse effects. So in your well control, again, it speaks for itself. You're going to have a controlled situation where you're really managing the symptoms there, and you're seeing a reversibility most of the time. Ages 4 to 0, that's 2 times per week. That's 2 days per week that they experience this, or the symptoms. 5 to 11, it's about the same thing, more than once on each day. And then ages 12 and over, you're going to see that at least more than 2 times per day per week. And that could happen in different times. You have different nighttime awakenings there. And if we go down forward to the very poor control, there's such a big difference. It's throughout the day for the very poorly controlled that they're having symptoms all day. They're extremely limited in their normal activities. They can't go outside, or they can, but they have to be very careful what they inhale, what they surround themselves with. So it can be very limiting as a person, especially during seasons where you're going to see a lot of that triggers around. SABA uses, again, once you get to that very poor control, you're going to see a big increase of use in there. Lung function spirometries, it's following the same pattern, so you're going to see not much of a difference for the well-controlled area. Not well-controlled area, you're going to see some difference, some loss of, your FEV1%, your FEV1 over FEV-C, and then it's not going to be applicable for those age groups that are so young. And then, of course, once you get to severity, you're going to see values spirometry very low, below 75, below 60, even below that. And then the questionnaires. Ages between the older ages were able to do so, not the younger ones, because they did the consent and so on and so forth. But yeah, they would see the different uses, the amount of times they've had to use their asthma and such as that. So for the risk, asthma exacerbations requiring oral systemic corticosteroids. Again, consider the severity and intervals since last asthma exacerbation. You're going to want to take that into a note. The reduction in lung growth, you're not really going to see that unless they take those specific exams or the specific testing, but it doesn't seem as though it has a huge effect on them. Treatment-related adverse effects. So medication side effects can vary intensely. Again, if you're taking Cialis all the time, you're taking your Cialis as a severe patient, you're going to get those tremors, you're going to get increased heart rate, you're going to feel diaphoresis, you're going to start sweating a lot. So you're going to see some clinical aspects show, but not only just for the severity people, unless you're just very frail as a person, and maybe even if you were a well-controlled asthma patient, you could probably see pretty much a reduction there as well. But again, thank you again for joining my talk, my video. You have a great day. Thank you.